Good morning, this is Dr. Morgan, and I'm going to show you my clinical movement enhancement routine. I usually do this for people who are stiff, who have any type of pain, who need some type of release, who need to increase their range of motion, decrease their anxiety, decrease their stress. So usually when I have a one-on-one client, after their workout, I'll give them a recovery clinical movement enhancement session. So while we're working out, we're stretching and we're ripping our muscles and we get really sore, really stiff. And the next day it's really hard for us to move. So in order for my clients not to get discouraged, I make sure they stay flexible, they have great range of motion, and they feel their best pre and post workout. So it's going to be about 15 minutes, so it's a great informational video. I'm going to do a full session and raw and uncut, and we're just gonna go. All right, and that's my client, Emmanuel. Follow him on Facebook, YouTube, Instagram, all of that. All right, he's a great artist, and he's out here in Baltimore. All right, take care of him, and we're gonna go face down. I use the Hypervolt gun. It's one of my favorite tools to use. I usually use it on 1 or 2. This is one of the newer versions. I still have the Plus, but I like this one. It's kind of smooth. And I use version 1 or 2, depending on the severity of the issue. So I'm going to use mine on 2 on Manny, and then we're going to go. So I don't always start with the traps, but I'm going with the traps, and I'm just pushing. I'm feeling any type of tension. And I'm feeling for his back and his vertebrae and his muscles to make sure everything is even, to make sure there's no unevenness in the muscles. Make sure that some sides are less tense than others. And as I push and I pull, I know the strength of everybody who gets on my table. So usually when I first meet you in your assessment, I know your body from the first visit. So it could be 20 people waiting for me, and I know the issues that everybody are having. Okay? I'm pulling a little bit. I know that Manny doesn't have any real shoulder injuries or issues, so I can pull pretty hard. I'm pushing and I'm pulling. I'm working on the levators, the scapula, the deltoids, the traps. And I'm going to get real hard on these traps because it's tense up in the traps. All right. Tight traps cause neck pain, headaches. Good. Put his arm behind his back. You see where his range of motion is in his shoulder. And usually before the session, I will measure how many inches that his range of motion is off if he puts his hands behind his back. And then I'll close your gap between 2 and 15 inches, depending on the severity of your range of motion and the severity of your pain. That was great, down. Hope we're not muted. We are, so what? Whatever. I'm working on the hamstrings. Hamstrings are tight. And I'm also going to work on the glutes. All right. I know Emmanuel is having knee pain, so I can pull while I'm triggering the glutes. I've always stretched people prior to this. And then when the massage gun came out, I just put 2 and 2 together, and I wrote a program for it, and I titled it Clinical Movement Enhancement. So you'll see people stretching and putting the gun on other people, but I think I was one of the first to put the whole 2 together, title it, and kind of make it streamlined to become my own profession. So that's what I did. And I have had a couple people come check it out. We're trying to do the same routine. Good for you. Thank you, and I applaud you for being the protege. And I wish you luck. And if you need some help, reach out. But We have a whole program for this. Um, we have paperwork for it, and I see about 40 to 60 people on a daily basis, effectively, efficiently, and swiftly. And everyone always asks, how long does it take? I keep you on my table as long as I can keep you on my table. All right, as long as I feel that you need it. So I'm still rotating. I'm rotating the hips while I work on the glutes, the piriformis muscle, the hamstring. I'm going to lift, and I'm going to expose the glutes, the IT band. Now the IT band is tricky. It runs from the hip all the way down to the knee. So if you stand most of the days, or if you sit at your job, your lower back, your hamstrings, your IT band, your calves, your soleus, your gastrocnemius are all probably giving you some type of issues. And you don't need a doctor for injections. You don't need any medication. Just come check me out, and I will get you right. So I'm pulling his leg back towards me. I'm seeing how strong his hips are. I'm making sure that there aren't any imbalances. So it's more than just grabbing a gun and just putting it on people. Good. And as I keep his knee on my thigh, I'm going to rotate his hip. So I'm going to bring his left knee to under his left underarm. And I'm rotating the ankle, the foot, I'm grabbing the toes, I'm knocking the pressure out the toes. All right, so I tell my clients to play dead, let me move your body. This might be your only 20 minutes you get to yourself on a daily basis, so enjoy it. Good, now I'm rotating his hip. Good. And sometimes the back cracks, sometimes the hip cracks, but that's never my intention because that's not my lane. But if it happens, it happens, okay? Good, so I'm gonna work his calf, his hamstring. I'm gonna pull his leg a little bit. I'm pulling at the top of the ankle, and I'm working the hamstring and the calves. We did a full body workout today, so this whole body has some tension going on. Let's dig a little bit deeper. Let's flip them around real quick. Lift, lift, lift. Good. You have to be in shape to do this job. We see about 50, 60 people a day, like I said, and we're lifting, we're moving, we're bending. All right, so here we go. Second leg, I'm pushing, I'm feeling to see if he kicks back towards me. If he kicks back towards me, that means he may have a knee issue or a quad, tight quads. All right, so if I can't get your heel to your butt, that means we have some tight quads we need to work on. All right, that's limiting your range of motion, and it's probably playing a part on your knees. Feet, everybody loves their feet. Remember, everything starts from your feet. The feet are the basement of your house. If the basement of your house is off, everything else in your kinetic chain is going to be off. Your ankles, your knees, your hips, your back. So we fix everything from ground up. And if you're having pain in your back, you really need to start looking at your feet because sure, we can keep caulking the patches on the wall. But if we don't fix the foundation, there's no point. All right, so we have to fix the foundation. That's step number one. Finding the issue, all right? Telling you how we're going to fix it, and then every 6 weeks, do a re-evaluation between treatments to make sure you're going in the right direction. Because like everybody says, numbers don't lie. I'm working his glute, hamstring, and I'm pressing his toes back. Not going to pressure out his toes, I'm pulling, and I'm going to lift. Good. And Emmanuel's really skinny, so it's really easy for me to lift him. so I'm not worried. Perfect. Good. So it feels like his right side is a little bit more intense than his left side. I'm gonna work this IT band while exposing this peripheral moors. Glute, hamstring, pull. Good. Calves, soleus, gastrocnemius. Good. I'm gonna whip them around, work those feet. I got into this because I like to treat others how you like to be treated. All right, I like to feel good, so I want to make others feel good. And this is the way I do it. All right. Good. I'm gonna pull it in. I'm gonna work the shoulders real quick. I didn't hit that top shoulder yet. Pull it, expose those lats. Good. In and out, there, work that shoulder, reach. I make sure he reaches for the stars. Here we go. We got a long career ahead of him, and you make sure he reaches for the stars on a daily basis. Then let's get this lower back. Good. Let's go put some pressure on him. Put his pressure on all the way up his body. Let's help with the circulation of blood flow. Then we'll rotate the shoulder. Pull a little bit. Two sides. In and out. Good. Take your time. We're going to flip over. Good. Now we're going to work the front part of his lower extremities, the quadriceps, the feet, the pecs, shoulders, and traps, all right? So tight quads bring knee pain, so it's really important, like I said, to keep the quads loose. And as some people lay here, their feet may turn in or turn out. Usually they turn out. I know their hips are tight. So when I go through the routine, I'll pull your foot inward towards your body, all right? To make sure that it's even and show you what muscles that we need to strengthen and enhance. So I'm working this quad as I stretch your hips. All right, so I got his hips. And his hips are tight as a pack of cigarettes, so we'll work on those hips a little bit. There we go. So then now we'll work the hamstring. All right, in transition. Good. And I'm feeling for if he's pushing back towards me, okay? And this is just a pre-hamstring stretch. I'm gonna go a little bit deeper into the hamstring stretch in a second. Good. Rotate your hip, rotate, rotate, rotate. Figure four, chicken wing. Good. Works that hip. And when I start to feel him pull back towards me, then I put a little bit more pressure so he bites me a little bit, and then we release. I tell him to take a deep breath. Then go work that hip, and then now we get on top. We pull the toe down, lock this leg, and then we up like we're up. Good. Tell me when to stop. I'm watching his breathing, his range of motion. I'm feeling for his tension, his resistance. So right there is pretty good. And Now bend it back in. Good, hold it, and we hold it. Good. And now we work this opposite glute. So we swing the leg around, hold it. Good. Then I'll even come around, make sure he's in the middle of the table. Cross that leg, and then I'll work that sciatic nerve or femoris or IT band. Good. You bring them out. Good. Switch legs. Here we go. Remember, work this hip. Hips are tight. Same quad. I'm looking for his resistance. I'm watching him breathe. I think he's alive. But I kind of threw Emmanuel into today, and I'm grateful for his opportunity to let me showcase my talents. And I want to thank him for hiring me to be a trainer and doctor. Good, work this hip. Good. Come out. Hamstring, calf, good, hold it. I'm gonna work his arms next, and I'm gonna come back to this left leg. But for some reason, the left side is my special side. Hold a little bit, work that hip, socket, a little psoas, the groin area. Just get these underarms and your lats. Shoulder pain comes from under your arms, your pectoral muscles, your deltoids, shoulders. All right, that's why we get all up in there. Down the rib cage, the kissing the door side, forearms. Good. Good. Cross it up. With the other arm, good. Work this pec muscle. We did a lot of push-ups today. We did a lot of upper body work. We did full body work. What you need to say for that, Sarah? What's your phone title?
Stop my bag.
Stop my bag. All right, here we go. Go to Apple Music. If you're online, go to Apple Music and type in "Stop My Bag." All right. What's your title? What's your title name? What's your brand name?
DDM.
DDM. Okay. Stop My Bag, DDM. All right. Here we go. I'm gonna fix this last left leg. And then we cut down to the deck. Rotate. Catch it. All right. Not too many people can rotate it. Catch it. Catch it. Good. Bring it back. Flip it and reverse it. Move it opposite. Okay. Yeah. Good. Lock this leg. I'm coming up because I'm 6'2", so tell me when. Good, right there. I felt the jump, so I just hold it. Bring it down. Game over. I appreciate you. Clinical movement enhancement, top to bottom. Come check me out. See me sweating. Good. It's a workout. Much love. I appreciate y'all. Have a great Friday. Dr. Morgan. We're out.